We are live with Dr. Eric Jauhiainen from the Department of Community Health Studios.
Hello.
Good afternoon, Dr. Jauhiainen. Thanks for joining us today to help our community get a understanding of what's going on with Omicron. So thank you so much for your time. And I guess the first question is, what is this Omicron variant everybody's talking about?
Obviously, with all these variants coming up, we're all going to learn the Greek alphabet. You know, we've had the native. You know, we've had Alpha, we've had Delta, and the other ones. Now we're at Omicron. So Omicron is another variant of the coronavirus that was first detected in South Africa. What I have heard about it is, you know, when you do these tests, you do a PCR test, you do a nasal swab or oral swab, there are about 2 or 3 different targets for what you're testing. You're testing different parts of the virus, and people can have a huge amount of virus. For example, I just read yesterday that a single nasal swab in a person who's got a really active infection, it might have 1 million viral particles on it. I mean, it's an enormous amount.
Wow.
So they began finding tests that were part positive and part negative. And what was missing on the tests were they were missing some of the spike proteins. It's like, what? We got coronavirus here. We got a person who's symptomatic, and we got a positive test, but it's only partly positive. So what's going on? So South Africa has a pretty sophisticated lab monitoring and tracking capability, and they immediately began doing genetic testing, and it turns out that they realized that what we've got is a highly mutated brand new strain of coronavirus. And by highly mutated, I mean it's something like 30 to 50 different mutations of this virus, which is way more than the previous mutations. So they began, the first cases where they detected this were November 11th, November 14th. And the World Health Organization then declared this a variant of concern on November 24th. And so South Africa started going back through its genetic sequencing of this. And in November, remember, it's summer down there, right? So they don't really have the fall surge that a lot of us, you know, are spending a lot of time indoors and going Thanksgiving dinners and stuff we have. So in October, about 80% of all the coronavirus cases that they're having were the Delta variant. But by the end of November, about 75% of them were Omicron and only 22% were Delta. So it is out competing Delta badly. And it's highly, so that's the bottom line is that's a very, very highly transmissible virus. It's a coronavirus. And mostly probably due to a lot of mutations that have occurred on that little spike where it attaches to what's called the receptor binding domain on your human cells. So it attaches, boom, like this. It's supposed to fit. And this part has mutated quite a few times. And so it probably, the reason it's so much more contagious is that it binds more avidly to that receptor binding. And and it's clearly way more contagious than the Delta variant, which was more contagious than the original variant that we had.
And it was found in South Africa, but where is it now? And then when you finish that statement, talk about closer to home, you know, United States,
Okay.
Washington State.
Okay. Well, we've had a few cases in Washington State. You probably know more about that than I do. And we're getting more cases on a daily basis. And these cases are not in people who have, you know, been to South Africa. The very first case in the US was detected December 1st. And it was on somebody who had traveled from South Africa. But the second case, you know, was somebody without travel. And now we've got it. We discussed that. It's something like 17 states. It's going up every day. It is here. It has been here. It's already been located in 57 countries. So the reason it's, we know of it first in South Africa and Botswana in November, and now it's 57 countries, is not that it's spread rapidly over a month. It's that it was there, we weren't able to detect it, and it is spreading. And I would assume within a month, almost all of the states will have cases of it.
So it's possible Walla Walla has the Omicron variant. If it doesn't have it now, it'll be just a matter of weeks before it's in our community.
I think so. I think it's a matter of weeks. Now, something we kind of talked about before we went on the air is like it clearly spread incredibly rapidly in South Africa. I mean, it outcompeted the Delta variant dramatically, and it spread more rapidly. Is it going to do it just as rapidly in the U.S.? My hunch is probably not as rapidly, because we're 60% of our population has full vaccination. We also, whereas South Africa is only about 10%. So people who are fully vaccinated are less likely to get symptomatic illness. They're less likely to get prolonged illness where they can share it as readily. They can still get breakthrough infections from Omicron, but hopefully won't be hospitalized, won't die from it. So my hunch is that the spread in our country is going to be not as rapid. But even in really highly vaccinated countries like the UK and Denmark, they're getting spread of Omicron variant. So it is going to spread. Which brings us kind of the next question. Do we know anything about the seriousness of it? Right? Compared to Delta. Is it more likely to put you in the hospital, or is it going to be, there's all these rumors, oh, it's more mild, it's like a cold or something like that. That is clearly unknown.
In the vaccinated, the vaccine seems to be protective. So in that case, we're still protected. Even though we might get a breakthrough case, we're still protected from severe illness and hospitalization and death. And
one of the things that was found is that the neutralizing antibodies in people who have had the two-part, mRNA vaccine are much lower than they are against Omicron than it was against Delta or the earlier variants. However, if people have a booster, the neutralizing antibodies expand like 25 times. So this is another impetus for getting your booster. It's like, you're just much better protected than just on the two-part. Just get the booster.
Right.
No matter whether it's Moderna or Pfizer, you'll be better protected against Omicron, which is here. And we haven't detected it in Walla Walla County, but I wouldn't be remotely surprised if it's here already.
And even though we're worried about, or at least thinking about Omicron, we're still dealing with the Delta wave.
Right.
So we can't let up our guard with that.
And I think we're going to see with Omicron, we'll see more breakthrough cases in people who have just had the initial vaccination, and so that's just another impetus for getting a booster. It's just like, And I really want to kind of also hit this idea of people saying, oh, the rumors coming out of South Africa, it's like, oh, it's not putting as many people in the hospital, that kind of stuff. Well, the average age in South Africa is 9 years younger than the U.S. Our median age is something like 36, 38. South Africa is 27, so it's actually 11 years younger. They have a younger population. They're less likely, but there's other issues too. They have a lot of people with, they have huge rates of HIV transmission, like that. But so the idea that, it's going to be a less deadly variant, we don't know that yet. And not all viruses mutate from more deadly to less deadly. Smallpox had been around for hundreds of years, and it killed 300 million people in the 20th century before it was eradicated. The Omicron variant, I learned something every day, and it's changing daily. It's like, but we'll know a lot more about it a month from now than we do here, but it's here.
Yeah. And also the message is there's no need to panic because we have the tools,
right.
The vaccines, the boosters, the masking, the hand washing,
right.
The distancing. So we have the tools to manage this. So for me, that's what gives me comfort.
That was an interesting, thing we just watched. people are saying, oh, well, the vaccinations may cause more mutations. It's like, no.
Mm-hmm.
So mutations, you've got a virus that has 30,000 amino acids on it, and every time it replicates, which is rapidly, it has a chance to make a couple of errors, and some of those areas make the virus less likely to succeed. Others make it more likely. It's just what viruses do. They mutate way more rapidly than your human cells do, and so it's the growth of infection and the spread of infection that allows more and more mutations. The less spread we have, the fewer mutations.
So it sounds like, in summary, Omicron's basically kind of like a new species. It's here. It's here, at least here in the state. And it's just a matter of time before it gets to Walla Walla. It's much more transmissible. We're going to see a lot more breakthrough cases. The illness, hard to know what the illness is like, but certainly in vaccinated people, it seems to be a mild illness. We probably will start to see the effects of this virus in the upcoming weeks. Maybe 1 to 3-ish weeks is hard to say. But the underlying message is that vaccines work against this.
Yes.
And it's a really good idea to get a booster to
Absolutely.
boost those antibody levels. So get vaccinated.
All right.
Well, thank you for your time, Dr. Jauhiainen, and your expertise. You're a true scholar of COVID. So thank you so much, and we appreciate it.
All right. Thanks.